Hello, and thank you for joining me today for my presentation on my critical analysis paper. My topic is the challenges of hospital readmissions and healthcare. This paper aims to address the issue of hospital readmissions and how they are an important challenge for healthcare managers. One of the primary challenges with hospital readmissions is the penalized reimbursement rate that is associated with the patient being readmitted within 30 days of discharge from the hospital. Hospitalizations are accounting for about half of all of the healthcare expenses, which is about 13% of the inpatients use more than half of all the hospital resources through repeated admissions. Healthcare managers are finding it progressively difficult to provide high quality and accessible healthcare when being penalized on reimbursements due to patients being readmitted to hospitals within 30 days of discharge. There is approximately 20% of Medicare patients that are readmitted anywhere from the day after discharge leading up to 30 days from the hospital. The estimated cost analysis is approximately $17 billion. The hospital readmissions have been so bad that they're associating them with the quality of care that is being received from that particular hospital. What is the Hospital Readmissions Reduction Program? Mandated by the Affordable Care Act, it is a payment penalty program designed to reduce Medicare fee-for-service hospital readmission rates. The purpose of the implementation by CMS is to utilize these penalties as a way to increase a reflection of a healthcare manager's viewpoint, as well as the efforts taken in order to reduce hospital readmissions, such as the financial impact. The financial impact for the healthcare managers is a percentage that is lost off of the guaranteed revenue coming in from Medicare or Medicaid for care that has already been given to the patient. Why are the healthcare managers being penalized through reimbursement rates? Hospitals are being faced with these penalties due to the continuous raising amount of Medicare money being spent on the same patients going in and out of the hospital. In order for healthcare managers to prevent unnecessary hospital admissions, it is imperative that they ensure that contingencies for different care options are put in place prior to the patient being discharged. There are different causes and effects on healthcare entities with hospital readmissions. The most common conditions that lead to hospitalization are pain, depression, mental disabilities, eyesight, and anxiety. When a hospital does not refer to another healthcare entity in a timely manner, it will often result in a loss of revenue for not just for the hospital, but for the other healthcare entity as well. There's different causes and effects on patients and families with hospital readmissions. When patients have a lack of knowledge of where the best facility or healthcare resource would work for their needs, including what type of facility would be covered under their insurance in order to cost them less out of pocket, it can cause the patient and family a lot of confusion and anger of not knowing what to expect next. There are solutions to minimize fines. The solutions are the case manager at the hospital being involved from the beginning of the patient's care can help improve outcomes for patients and or families in order to reduce these readmission rates, such as eliminating avoidable days in the hospital, enhancing management of claims, and ensuring the provisions of coordinated care for that patient. The importance of education for both hospital and the community are utilizing their resources other than the hospital in order to increase a patient's knowledge about their disease and or illness, which can lead to fewer readmissions and fewer financial costs to both the hospital as well as the patient. After a patient has been in the hospital, they typically have a decline in their functional ability that cannot always be reversed due to disease progression or age factors, etc. Many different strategies have been implemented in order to reduce hospital readmissions, such as having case managers educate their patients on their new and existing medications, schedule follow-up visits prior to the patient's discharge from the hospital, taking the ownership of ensuring that primary physicians receive the documentation about that patient's hospitalization, following up on those results on tests that were completed, and having a designated person from the hospital checking up on those patients after their discharge within at least 24 to 48 hours, and then again in a week to ensure that meds were picked up, as well as seeing their physician for their follow-up care. Thank you so much for taking the time to listen to me today, and I hope you enjoy my paper. Thank you.